Telehealth is real. It's happening across our countries. And it's really, it takes all of us to move it from mostly research projects in particular institutions to models that can expand across populations and communities. And this group here can do it.
It's imperative that we use technology, we find out how to use it in a way that can really make a difference, not as a replacement for nurses or a replacement for healthcare employees, but as an adjunct in a way that's meaningful and important and can lead to improved outcomes.
Because he was saying, well, I was saying my answer to everything is research, and he said, well, you need to look at what is in it for me, what's in it for the doctor, otherwise you won't. Evidence is the first step, but the next step is find out what's in it for me, and I think that's related to implementation research. We need to focus on that.
There's a lot we still can do to probably compete on a global scale. The path of an innovation starts with a creative idea, and it goes through the ecosystem, and it arrives at the patient, improving the patient's life. And I feel we didn't discuss how we get the ideas into the healthcare system. We all know there are startups and ideas and from many different industries. ChatGPT is one that is not related to health at all, but it will be a lot in the future. But the question is always, in my mind, how do we help them into the revenue streams of hospitals and the healthcare system? And I feel it's a really complicated answer to that I would have loved that we had discussed more.
I would say the encouragement of using the new technologies, get out and get us going using them. We have shortage of hands. Let's get some experience.
All right, so mine's going to kind of piggyback on Birthe's, and we didn't really talk about this at all, but I really think we have to make sure that at every one of our institutions where we possibly are going to be using technology, that we have innovation leaders. So it could be a natural leader, it could be, the chief nurse officer or the information officer, but we need to find out who those innovation leaders are, because they're the ones who are going to be able to help bring innovation in and get disparate users to use it and find out how well it works. And if we just have companies target somebody in the field, the COPD field or heart failure field or whatever it is, they may not be the right person. They may be personally interested, but they haven't looked at that bigger, broader picture, and that, to me, that is so very important.
One gap is that we haven't talked at all about innovation in business model. We are still expecting the reimbursement system to pay, the efficiency to cover the cost, company to client. We're not talking about what we've learned in digital and other digital solutions, open source model, coalition models, public-private partnership models, many other business models that could help us in digital health, and we haven't talked about those.
I think one of the biggest challenges I see day in and day out are overburdened nurses who can't get the job done during the day. And I think my first comment was it's imperative that we use technology, and we need to find what is the right technology, how it can really be useful. And I think it's going to be a major paradigm change. So it's going to change the way people work day in and day out, whether it's somebody who's working off-site doing certain things for certain groups of patients. We have ideas in our head about how we want to go down this road, but it would be great to see others have programs and share them so that we could all learn and figure out what works for each of us.
I also see staff who don't have the energy, who don't have the time on a daily basis even to look at how to use new technologies. The time just for caring for the patient is used, and they don't have the time. So I think a big challenge is how can we help? How can we help on opening eyes for new solutions on how to use technologies to work smarter, not harder?
I'm not exactly sure how to say this. I think our biggest challenge is that we don't have time to dream. Like, we talked about a lot of things at these 2 days, and I've been incredibly inspired by many of the conversations. And I fear that we'll all go back, and the next deadline will hit us, and the next grant proposal that requires us just to base our next step on the 5 previous steps we just did. It's not really innovation, it's about incremental change. that all these big ideas that we've been talking about here, we won't actually have the freedom and the mind space to invent the thing that would actually solve the problem.
How to help with fast track implementation and help get the technologies out there.
Yeah, and use, if we are pushed to initiate new digital services, then we might not be able to do a randomized controlled trial, but could we do an observational study? So can we find a bit more simple, but also a bit more easy ways of doing research, so we just follow what's going on, so we at least do collect the data? I think there's lots of possibilities there.
Fast track and simplify implementation.
They've said a lot of the things I may have said, so I'm going to just change it up a drop and say, we spent a lot of time talking about digital health. We spent a fair amount of time talking about AI, but we didn't talk about bots very much. And I do think that we're in the era of robots right now, and we need to think about what kind of robots can work for us, with us, to improve the health of our patients, and also to create efficiencies and increase awareness of needs within the hospital system, and possibly in academia as well, but I'm focusing on the hospital. So I just put that in line from a research standpoint.
I heard that the Danish researchers from the island of where Kristian is from on the radio in Denmark saying we need to be working with robots, not that they're just doing the jobs, but the future it has to be collaborative work.
I wanted to add on to what I was saying, because I was trying to stay within my 30 seconds.
You've all been bobbing.
Okay. So the reason I was saying that was we've been talking about AI and the bias in AI, because what we use are, and I'm not just talking about LLMs, but talking about other kinds of AI and decision support that we do in electronic health records, but we rely on institutional data. And we know that most of the data is not institutional data. It's consumer data, it's environmental data, it's what people generate on themselves through their everyday lives. There's vast amounts of data that we never leverage because we don't know how to get it, we don't know how to ask people, can we use it? We've never tried to analyze it beyond some very general sort of social media, data mining kinds of things. And if we move into this AI, everybody's on AI right now, right? If we move into this and just talk about, it's biased because of the data sources and because of the way we approach it, well, if we don't solve that now, we're going to go to another generation of AI hype that doesn't generate what we need.
So I agree 100%. Most hospitals and healthcare systems have been putting more emphasis on population health and prevention. I have a $600,000 grant that we're just waiting for the contract to be signed with the company, and it's a prevention strategy. So we're hoping that this international research study of 5 countries we're hoping that our hypothesis works and we can maybe help to prevent heart failure, or if we do find it, diagnose it earlier, treat it earlier, so we prevent death and morbidity over time. So I think that in general that needs to be a very strong thread in our near future for all researchers and for healthcare leaders to be pushing that.
I would like to add to it, Martin, because I've done a lot of research on how to prevent worsening of symptoms and how to prevent different diseases. And I think there's a lot to be done, and I think we could think much more creative by using the digital tools, and also have the hospitals where there's shortage of staff, but also out in the municipalities, let them use the digital tools much more, because it could maybe take a little of the burden.
This has been amazing, and I've had so many great talks with so many new people and old friends, and I look forward to we doing this in 2 years, and I look forward to somewhere you will come to the city of Odense and join me at home at the city of Svendborg and our PhD course. Thank you.
I would also like to say thank you very much for all the Danish and international guests and US guests who have been here, and all your engagement. And I really do hope that you have exchanged cards or digital cards, and you do something, not just exchange it and send an email, but really that you try to get a collaborative effort up for the benefit of patients and the healthcare sector, and use the knowledge you have gained here. So thank you so much for all of you, and also for the Innovation Office to support this event.
So I'd like to thank the speakers for all the different sessions that I was able to attend. I learned a lot, some of it new, some of it reinforcing concepts I already had. Also for the people who've come up to me and just asked questions. They've been great questions. It's been fun having discussions along the last 2 days at various points in time. I think we all have a lot to learn still about digital health, AI, and this whole space of telemedicine. And so the communication and collaboration is really important because that's how we grow. So thank you.
I've been just completely inspired by the last 2 days. I think there have been at least 5 projects that I've cornered people about that we'd like to try and collaborate on. So it's been really generative meeting for me. The other thing that just want to mention is the last time I was at a TTRN conference in Copenhagen, which I think was 5 years ago, the difference in the level at which we've actually accomplished things this time compared to 5 years ago. 5 years ago, it was all about, couldn't we do this? Couldn't we try that? How about if we, now it's like all those things have been done. We've come so far in 5 years, even through COVID. And so that's what's been so inspiring. Like, we could do this, and in a few years we could do that too. So I've just really just appreciated the whole conference.
Even from last year to this year, I think. And then Jan.
First of all, what an honor to sit here amongst you captains of healthcare. But as I'm looking at the title, that just turned off, but it's not really transatlantic, it's not American, it's not Danish or Chinese or any other nation out here. It is a global task that we have in front of us. So it echoes what you said, that we need to stop thinking in these little groups, that we're all in it together to make the best healthcare for everyone through technology.